June 16th, we're here with Dorothy. This is her first visit, and she has marked degenerative disc disease in her neck with impingement of discs on the spinal canal. And one of them is actually touching the cord itself, and you've had some problems even with muscle, correct? Your biceps.
I had temporary paralysis that occurred numerous times over about a week period.
And this has all happened to you in the last 6 weeks, correct?
It was about 6 weeks ago. I haven't had any symptoms since then.
Okay.
Except that my neck hurts.
Understood. So we want to check your range of motion. Can you turn your head to the right, please? And that's fairly limited. To the left, please. That's quite limited, extremely limited. Bend it back. Let's come over here. And that's very, very limited, and bend it down. Okay, thank you very much. And you understand I'm videoing this and I may post this on YouTube?
Yes.
Thank you very much. Well, you got a smile on your face. Thank you for your comment. We just completed the treatment on your neck and also your knee. You asked me to do that as well. And what's your comment at this point?
I have more range of motion.
To the left, it's dramatic, significantly more.
Yeah, I could only see your degree there, and now I can actually see the wall over here.
Okay, and now let's have you turn your head back, go back as far as you can, and down. Okay, and I'm going to do some measurements, and we'll show that in just a moment. Do you want to get up and walk and tell me how your knee feels?
It just feels normal.
Just feels normal. Okay,
yeah.
You just wanted that to strengthen it, correct?
No, I want the twinges to go away.
Okay, very good.
I can walk, but it twinges if I climb stairs, or especially if I'm carrying anything.
Okay, good.
Let's do it.
Yeah.
It pops.
Okay, sit down just a moment. Do you want to get up and walk and tell me how your knee feels? Okay, I'm showing you now what happened to you. Your flexion extension total was 86 before, and your rotation was 114 before. After we did your treatment, your flexion extension jumped to 98. That's 12 degrees improvement instantly in flexion extension, and your rotation went up from 114 to 134. That's 20 degrees extra. Most of it coming, well, it's probably a balance, right and left rotation. Both of them did better. What are your thoughts on the range of motion change?
Well, it feels much better. It's not crunching like it always did when I turned my neck before. It made a horrible sound.
In terms of pain when you move your head, how's it feel?
It feels a little stiff on this side, but not really painful.
Okay.
No pain on the right.
You've had prolotherapy before from another doctor. How does your experience with what I just did compare with prolotherapy?
Much less painful. I used to have to take Vicodin to get through it. So this was fine.
Okay. This is something you recommend to others then, correct?
Yeah, this is great.
Okay.
Easy.
Easy. Good. I'm glad to hear that, because you had asked me to do something for pain beforehand, and it didn't turn out to be anything like what you had expected, correct?
No, not at all.
Okay, thank you. And again, I may post this, correct?
Sure.
Thank you. You're smiling. What was that you were just saying about your knee?
I said my knee is phenomenal.
What has made it phenomenal?
Well, you just did Prolozone, so
Right.
it's my first Prolozone experience.
But I mean, how is it different that makes it phenomenal?
Well, it's not making noise because it usually
right.
creaks and cracks and groans. And I have full range of motion. So,
Good.
Very pleased.
Thank you. We're going to do your thumbs, as
Yes.
you asked me to do your thumbs.
Thumbs.
She's got arthritis in the base of both thumb joints, one can see. Today's June 23rd. We're back again with Dottie. We did Dottie's neck last week and her thumbs and her knee, and she's going to tell us what happened. How did the Prolozone do for you?
The knee has been absolutely perfect. Like
one shot.
Overnight, I had a new knee with no post-surgical pain.
And didn't you tell me you had bone on that knee?
I had an MRI in 2007, and it was bone on bone. So I've been working with supplements and prolotherapy off and on since then. I haven't had prolotherapy in about 4 years. But
how did this compare to prolotherapy?
Oh, much less painful. I used to have to take Vicodin before I had the prolotherapy in order to stand the pain. This was minimal pain for for 60 seconds.
And how are the results compared to prolotherapy?
The knee, it probably helped the knee, but this seemed instantaneous. I mean, I've not had one twinge in a week.
Wonderful. You mean the Prolo may have helped the knee, might have, but
it probably helped rebuild some cartilage along the way, because I haven't felt like I was bone on bone for quite a while, but I still had twinges every time I moved, climbing stairs,
and this cleared everything
and
out.
This feels much, much better.
Terrific. How are your thumbs?
Thumbs, I did not have one twinge all week, and I am on a computer keyboard or texting all day long, every day. So
for the viewer, we did the base of your thumb right here on each side.
Right.
So you're pleased, and now you want me to expand and do your SI joint and some other areas.
I have
correct?
a hip that's got a problem, so I want the hip done, and I want my neck done again.
Okay, and I may post this on YouTube?
Yes.
All right, for the viewer, the range of motion of your neck has held. You lost maybe just a couple degrees, but it's very insignificant compared to what you walked in here with. And you notice your range of motion of your neck is better, yes?
My range of motion has improved, and I have not had any real pain with it. It's been comfortable.
Thank you very much. I may post this?
Yes.